The Senate has come together to make a couple of points, and we'll let Dan Brown, Senator Brown, Senator Selby come up and explain some points, and if Senator Walsh wants to chime in at that time. But we're here as a united Senate talking about an issue that our two senators will be discussing. So I'll let you two have it. Go ahead.
Thank you all very much for coming, number one, and I'm just going to read kind of a short statement. You know, the House kind of put an amendment on Senate Bill 217 today that we don't think is going to be helpful dealing with the problem of the seniors, the point counts, and that kind of thing. So when the Senate passed the budget in April, the senior care services were fully funded. The Senate had restored a 3.5% provider rate cut for nursing home providers and a 3% cut to in-home providers. We moved the level of care points from 21 to 24 as a compromise, and we talked with providers about that. We talked with different groups, and even though the level of point care going from 21 to 24 or higher, they agreed to that change. So that fell apart in the conference committees. The Senate stayed late last Thursday night and worked in a bipartisan way to find a workable solution for HCB3. And we funded the senior services line that had been set up, and we restored, we took the point count back down to 21, and we restored half of the provider rate cuts. That's all we could do the way the budget was written at that point. So the House has refused to take up our position. Instead, they're gambling on the backs of our senior citizens on a pipe dream, which hopes that this money will be there. The Senate plan used money in general revenue, money that exists right now. The House is using phantom funds that are unrealistic and will never come to fruition. This position will hurt the most vulnerable, the elderly, and the disabled in our state. Senator Selby.
Thank you. I think Senator Brown summed it up very clearly. The Senate is committed to making sure that nursing homes and in-home will have the money that they need. That's why the Senate position in HCB3 is to use general revenue that exists currently on the bottom line. We don't believe that these funds will exist in the excess revenue fund. And frankly, what we did in HCB3 has been done before. As recently as 2013, we directed the state treasurer to deposit into the Senior Services Protection Fund $55 million in that year to make sure that these services were funded. This year, we're only directing $35 million. But it's been done before, it was implemented, it is constitutional, it was carried out, it was voted on by many of the people who are still in the legislature today, and it was administered by the governor. So we know it works, and we know that it will solve the problem, and it is much better than planning on money that we don't think will be there.
We're here tonight in solidarity. Oftentimes we stand in this chamber and we argue to no avail. We don't have answers to each other. We just say, no, your idea is wrong. What happened last week was really historical in this building, that we all came together and somebody said, well, here's an idea. We all got behind it. We see it as a viable answer to save the seniors in this state that desperately need the resources that Circuit Breaker provides. I think it's a good plan, and I stand with my colleagues in my caucus, and I stand with my colleagues in the Republican caucus, and I'm proud to do that today. And with that, I'll turn it over to Senator Perles.
I think clearly we've made the statement about the camaraderie that clearly we've had the last week, 2 weeks. And too often we know that partisan gridlock really derails good public policy, but not this time. You know, this time in the Senate, as stated earlier, Republicans and Democrats came together and found a simple solution for funding programs, these programs for our seniors and those with disabilities. It makes no sense, really, that the House budget leaders would try to pass last-minute legislation that is unrealistic and seeks to jeopardize the health and welfare of nearly 120,000 seniors and those with disabilities. Only funding those programs in the event that we have a roughly, $80 million in excess funding over the next month and a half is unrealistic and is disingenuous. Senate members met for hours on end, coming up with a solution. We've had a lot of discussion about the funding sweep. For those funds that would be eligible for sweep for the $35 million, total over $3 billion here in the state. That's less than 1%. That funding is adequate. Those funds that were not excessive, and those, of course, that there would be maybe some danger or concern to those in the state that we would potentially reduce funding, of course, those funds wouldn't necessarily be eligible. So with that, I'm proud of the work we've done here in the Senate. We have a very viable solution, and I'm really disappointed at this point that the process has taken the turn that it has from the House.